We have had a lumbar puncture clinic for about 7 years for our neurology clinical practice, and we've used CSF biomarkers, the Roche Alexis p-tau 181 to A beta 42 assay primarily, and we have done biomarker testing now on over 400 individuals over the last few years. We were doing only CSF biomarker testing at first because amyloid PET scans were about $6,000 to $7,000 out of pocket, and of course, most patients can't afford that, and there were no blood tests available. But that changed in 2022 when we started using the first clinically available blood test, which was PrecivityAD2 or AD, and we used that test in almost 100 patients, primarily patients who, for whatever reason, couldn't get a lumbar puncture. Maybe they were very anxious about the procedure or were on anticoagulation. And the results were primarily used to help us reorder our differential diagnosis. At the time that we were using it, there were no disease-modifying treatments available. So we mostly did the testing because we really didn't know what the patient's diagnosis was. And the testing was used to help us better understand whether they had Alzheimer's disease or something else. Then in August of 2023, the PrecivityAD2 test became available, which was much higher accuracy, and we started using that quite a bit more than we had used the original Precivity. Again, because it's been demonstrated to be more accurate. And by that point, we had started treating patients with an anti-amyloid therapy, Lecanemab. And so in a few cases, we actually did have patients where the only biomarker testing that we did on them was PrecivityAD2, and we started them on Lecanemab on the basis of their positive test. Just as a caveat, those were patients where they had a very typical AD dementia syndrome and they had a clear-cut positive result. They did not have kidney disease or other comorbidities that could skew the results. So this certainly wasn't all comers where we were using the blood test. For patients who were receiving Lecanemab, we mostly use CSF and amyloid PET scans for confirmation of amyloid status. One question that was asked is, can you start a patient on Lecanemab solely on the basis of a blood test? And that the answer is yes for patients who have the Lecanemab covered by Medicare. So Medicare will accept blood tests. I don't know if they have any restrictions, but we have used PrecivityAD2 to confirm amyloid status in patients who have received Lecanemab covered by Medicare. Again, we are very selective about the cases that we're willing to do this. However, private insurers will not allow amyloid confirmation with blood tests for purposes of starting Lecanemab. So, and those patients who have primary or private insurance, we use either amyloid PET scans or CSF tests, and sometimes the insurance even specifies that they want amyloid PET scans. So things also changed in our field around January of this year when Medicare started covering amyloid PET scans. And we have increasingly been performing amyloid PET scans in our patients in the last several months. And the major issue with that is that we're losing $2,500 on every amyloid PET scan we perform because Medicare does not reimburse us the cost of the test, which is the radio tracer, the time on the scanner, and then the read. So that is a consideration if you want to lose $2,500 on every test that you do. In some cases, we really like the amyloid PET scan because it's seen as the standard of truth. However, we're still doing quite a few CSF tests, and again, also blood tests in select patients.